Good day and welcome. Welcome again on today's edition of Children's Clinic. Like you know, on Children's Clinic, it is a program where we take a look at children-related ailments and diseases with a view to finding a way around it and helping parents to manage or live with such ailments. And today on the show, we'll be taking a look at a whole lot of issues. We'll have health news. We'll have a doctor who will be coming on the show to talk about children living with diabetes. We also went to town at the program to sample people's opinion about their education on diabetes in children. This and more we have for you coming on the show this evening. My name is Jumoke Adeswa. Welcome to this edition of the program. It is Children's Clinic, and on the show today, we'll be taking a look at children living with diabetes. But before we go to the interview segment with the doctor, let's watch this package on diabetes in children.
The diagnosis of type 2 diabetes in Nigeria is becoming more common in Nigerian children, especially those who are overweight. Diabetes, also referred to as hypoglycemia, is a disease that causes blood glucose levels to rise higher than normal. Type 2 diabetes is now fast becoming an epidemic that requires close attention and adequate knowledge in order to put the disease in check. Type 2 diabetes is different from type 1 diabetes, known as juvenile diabetes, which occurs when the immune system attacks and destroys the cells of the pancreas that produce insulin. In type 2 diabetes, the body still produces insulin, but it does not respond to insulin normally. Glucose is less able to enter into the cells and do its job of supplying energy. According to the International Diabetes Federation, there are about 387 million people living with the disease in the world, with about 3.747 million cases of diabetes in Nigeria in 2014 alone. Unfortunately, type 2 diabetes in children accounts for almost half of newly diagnosed cases. Projections estimate that this figure will almost double in 2035. Although it is not certain what causes type 2 diabetes, there seems to be a genetic factor attached to the disease. It is estimated that 45% to 80% of affected children have at least one parent with diabetes and may have a significant family history of the disease. In the past, doctors associated type 2 diabetes as adult onset diabetes because it almost exclusively affected only overweight adults. Today, the case is no longer the same, as more children are being diagnosed with type 2 diabetes. Over 85% of people with type 2 diabetes have greater risk of death from complications of diabetes like brain disorder, loss of memory, heart attack, stroke, kidney failure, limb amputation, and even blindness. Children with type 2 diabetes develop a cosmetic skin condition called acanthosis nigricans, whereby kids develop thick, dark, velvet-like skin around the neck, armpits, groins, fingers, and toes. The epidemic of diabetes in children in Nigeria is linked to the regular and increased consumption of refined carbohydrates, soft drinks, cow milk, coupled with lack of physical activities. Since type 2 diabetes is linked to poor diet and inactive lifestyle, it is important to impart knowledge about diet and its implication to prevent diabetes in Nigeria. Several studies have proven that only diet and lifestyle modification could prevent diabetes or reverse its progression in the body. It is therefore imperative that children living with diabetes should take the following precautions and measures in preventing or maintaining the disease as the case may be. Eat a healthy diet to help achieve normal body weight. Participate in physical activities regularly. Monitor blood sugar levels regularly. Take insulin or other medicines that help the body to respond to insulin more effectively. Finally, work closely with doctors to get best possible control. In conclusion, with the teeming number of school children affected with type 2 diabetes, a deadly disease that reduces lifespan by 15 to 20 years, prevention of diabetes is the key to the pandemic in Nigeria.
I am sure that you have learned one or two things in that package you just watched, talking about diabetes in children. A lot of us are ignorant about some of the little things we should know when we're managing or raising our children. As parents and what, we should be very, very careful and know more about the health of our children. Again, we'll have health news on the show today, and on health news, stay tuned and just have some information.
Children, adults can be cured of cancer for life. In a move to rekindle hope for persons living with cancer, experts say children can be cured for life. With over 250 Nigerians affected by cancer every year, the Nigerian Institute of Medical Research, NIMR, has said that its new Cancer Research and Training Center will provide training and quality research into the rising cases of cancer in the country. During the official commissioning of the new Biomedical Training and Cancer Research Center in Lagos, it was disclosed that the capacity of the diagnostic machines at the center, built and equipped by Simtex Patek of Germany, is capable of investigating various kinds of hematological disorders. The multi-million naira facility, being a public-private partnership (PPP) arrangement between NIMR and the German technology company Siemens Patek, currently has a cancer research laboratory and office, biomedical laboratory that houses NX series, hematological analyzer, and conference offices, among others. Lack of incubator killing Nigerian baby. No fewer than 700 newborn babies die in the country as a result of lack of incubators. In a news briefing in Lagos, lack of incubators is a leading cause of death in newborn babies, among others. According to the report, only a few health centers have functional incubators, while many lack the facility. There's also a shortage of infrastructure, inadequate skilled birth attendants, as well as poor planning and implementation of health programs as other major contributory factors. Furthermore, among the factors that lead to the high rate of infant mortality is the weak nation's health system, particularly in emergency care provision, as an acute shortage of neonatal services across the country. The report concluded that there is a need for Nigerians to establish acute care centers for sick babies and premature babies, especially those born outside public health facilities. Doctor asks federal government to tackle rising heart diseases. The Nigerian Cardiac Society has called on the federal government to provide adequate facility to enable medical personnel to cope with treating heart diseases, which has been on the increase in the country. The medical expert advised Nigerians to cultivate the habit of eating healthy diet for a healthy heart, while stressing that exercise is an important factor to keep the heart in good condition. Also, Nigerians are advised to abstain from feeding their children with junks, but good fruit, with fruits and plenty of vegetables, saying healthy diet will reduce incidence of health-related problems. In a speech, the chairman local organizing committee, Professor Bode Balogun, urged parents to allow their children to engage in physical exercise, which includes trekking to school as much as possible, rather than living sedentary life and playing computer games.
There's an hormone called insulin in the body that regulates sugar. When that hormone is not effective enough to regulate that sugar, it causes the sugar in the body to be excess, which have some adverse effect on the body and which cause sometimes sickness.
And you keep to doctor instruction, like if you are asked to avoid sugar and some other substances like that.
If we are saying diabetes is too much sugar in the bloodstream, definitely when you reduce the sugar level, sugar intake reduces the risk to diabetics. That's what I think can actually reduce the risk of diabetics, really.
We have diabetes in Nigeria and a high level of diabetes because of various things we consume. I don't want to mention brand names, but we need to check and consume more of fiber, our local food.
Diabetes is not a disease. So anyone who has diabetes, it can be monitored, it can be controlled for a long time, depending on how you take your diet. So to control diabetes, you try to eat a little bit of carbohydrate, protein.
Hello and welcome again to this segment on Children's Clinic. And on Children's Clinic, like as we do every week, we take a holistic look at some ailment with a view to finding a way around it and making it easy for mothers or parents to take care of the children. So again today we're continuing that vein, and then we're taking a look at diabetes in children. Today on the show, I'm privileged to have Dr. Abayomi Afe in the studio. He is a public health physician. Dr. Afe, thank you for being part of the show today.
Yes, thank you for having me.
All right, like I said, we're taking a look at diabetes in children. Let's start off by knowing what diabetes is.
Diabetes is a chronic condition of glucose metabolism, abnormality in glucose metabolism as a result of insufficient insulin or abnormality of the insulin. Insulin may not be enough in quantity, or even the few quantity of insulin that's available is not effective
in the system. So it's a disease of quantity or quality, abnormality of insulin in the body, in the system. Okay. Now, is diabetes in children different from diabetes in adults?
Yes. In terms of pathogenesis, that is, pathogenesis means in the course of how the disease come about. The difference between diabetes in children and adults is not much, and also in terms of the types, the difference is basically in the types of diabetes. In adults, whereas we have more of type 2, in children we have more of type 1. And type 1 basically means that insulin is not present in the body at all in large quantity, in the normal quantity that's expected. And often is due to the destruction of the organ that produces insulin, the pancreas. The body itself reacts to the organ, destroy that organ such that the organ cannot produce insulin. That gives rise to type 1, which accounts for 90% of diabetes in children. Whereas in type 2, insulin is present, but the body does not respond to it. We call it suffering in the midst of plenty. You have plenty and yet you are suffering. So that is type 2 is commoner with adults. So in terms of the frequency of the type, you may say there's some difference between diabetes in adults and in children. But in terms of the symptoms, they are basically the same.
Okay. Let's talk about the symptoms or the beginning signs of diabetes in children.
Yes, in children can actually present with any symptom that is seen in adults, but there are three commonest symptoms in children. The first is thirst, excessive thirst, or called polydipsia, followed by polyuria, excessive urination. Children goes to urinate frequently. They are weight loss.
Weight loss
in children.
Okay.
Although other things like infrequent recurrent infection can also come in. The child can now become lethargic, that the teacher become very weak and withdrawn, and so those are the commonest symptoms of the diabetes in children.
Okay. At what point will a parent or a mother begin to worry? Because ordinarily, if your child wants water, you will think it's good enough. Let me continue to give him water.
Okay.
And if you urinate, you might want to think, well, because it's taking a lot of water in. So at what point should a mother or parents be worried about the symptoms in the children?
Yeah, a mother should actually become suspicious of the child having diabetes by the time these symptoms we talked about. If if you begin to observe over a long period of time, several months, several weeks, and then and there's a lot of intercurrent infections. What I mean is that the child is coming down with a lot of other infections. Unfortunately, unlike in adult, when adult can actually be diabetic for many years without knowing it and eventually get to make a diagnosis of the 3 or 5 years down the line. In children, the presentation is always severe, such that because mother did not get to know on time, they may think it's malaria, they may think it's cold, they may think it's some other thing too. They progress very fast to the complicated phase of diabetes, which is what we call ketoacidosis. That is, the child may become unconscious, the child may begin to lose weight, and a lot of other things may come in seriously. So a mother should actually become suspicious if, in addition to all these symptoms, you see a child that is very weak, becoming lethargic, losing weight despite excessive eating, and the urine frequency has something to do with the climate. Whether at night, on the daytime, the child is much more frequently, both in the dry season and the wet season. So you may actually have cause to begin to worry. Although coupled with things that you can't just explain. It's not malaria, it's not fever, the child can't.
And then it's coming down with infections.
It's coming down with infections, exactly. A lot of repeated infections in children. So and then you keep treating, and then you probably begin to suspect diabetes. Much more for the educated ones if there's an history of diabetes in the family.
I was going to say that
exactly.
Is hereditary.
Exactly. Much more for the educated one. If the mother is diabetic, especially if the mother was diabetic in the last pregnancy, the pregnancy that led to the birth of the baby, the mother had what we call gestational diabetes, the child stands a higher chance of becoming diabetic too. Also, there's a family history of diabetes in the lineage. Maybe a sibling. If a sibling is already been treated for diabetes, or a grandmother, or an aunt in the family, it may even be the father that's already been managed for diabetes. So the child stands a higher chance. So if you put all this into context, the background family history of diabetes
plays a major role.
Then coupled with all those presentations, then the mother should begin to suspect.
Okay. Apart from it being hereditary, are there other causes of diabetes in children?
Talking about other causes of diabetes, we do not have, we can't really say specifically that this is what causes diabetes, but what we know is that we have risk factors that may actually contribute to diabetes. Basically, in fact, to summarize it, what we do say is that environmental triggers genetic predisposition. What that means is that you are naturally predisposed to coming down with diabetes, but if you now find yourself in an environment or find yourself indulging in sins that may unmask it, that's when diabetes now come out. So if a child has history of diabetes in the family, the child is not feeding well, the child becomes obese, malnourished, or has obesity along the line,
or is going down with weight.
Exactly, thank you. So in addition to the genetic predisposition, other environmental factors like weight gain in children, and some other drugs. There's some drugs that children are also exposed, like steroid. If a child has to if a child has to be placed on steroid for a very long time, will actually come down with diabetes, and some other chemicals too that children may get exposed to. A very common one are the chemical used for rodenticide. One of them will actually predispose to diabetes. Then even eating habits generally. Much more, another important factor is actually sedentary lifestyle. The child, you see a child who is eating so much and yet does little or no physical activity. Always sitting in front of the TV, watching TV from morning till night, and binging on food. You know that child is a matter of time. Provided there is a family history of it.
Okay, all right. Having identified all of this, we've talked about the causes and why, when a mother or parent should be worried. Now let's talk about coming to terms with the fact that your child is down with diabetes. What steps should the parents or what take to manage this?
Okay, yes, getting a diagnosis of diabetes in your child is not something that is actually palatable, of course, because what that means is that it's going to be a drastic change in the lifestyle of the family, the parents, or the child. And diabetes is an irreversible condition. That means the child is going to be managed for life. It's for life. It's not curable. So that basically means that there's going to be a lot of change in the family lifestyle and eating habit. To start with, in most cases, the child will need insulin as a form of a treatment. So the mother or the father or somebody in the family should be prepared to be taught on how to give insulin and how to manage the child. And by the time the child is getting older, so the child can be empowered to probably monitor his or her own glucose level and also probably take this drug. That is one. Then talking about the diet of the family. Basically speaking, there's actually nothing really different in the diets of the diabetics. I may shock you with that. It's just a matter of eating healthy diet. The normal healthy diet that is good for somebody who is not diabetic is also good for somebody who is diabetic. So basically, it's actually something that change in the diet of the family is actually something that will benefit the whole family. It's the issue of the popular belief that they should not take sugar and some of those things does not really hold that much. It's just a matter of controlling the quantity.
And also when it is a hereditary thing, it runs in the family. So we're talking about the diet now. So it's a matter of the whole family.
Of the whole family.
Managing what
exactly, the whole family have to manage what they eat and much more for the child, so that the child will not feel out of place and will not begin to will also be able to fall in line. Of course, like I said, the diet is actually, diabetic diet is a diet that can actually benefit even the non-diabetic too. So that is one. Then another thing is that they should also let as many people as possible around the child. They should let them know about the child's condition. Because there are actually some complications that may come up, like the low blood sugar, hypoglycemia, that may lead to coma and shock in the child. So the teachers have to know that the child is diabetic, the friends have to know that he or she is diabetic. And then even in some settings, in some developed settings, there ought to be a hospital or medical record of the child, always in the child's bag. As long as the child is well monitored on the treatment and he or she takes over, by the time she becomes an adult, she gets to know that these are my limitations, that the thing I should go. They can live a normal life. If a girl, she can get married, she can have children, and she can live to any age.
Again, let's talk about the issue of the exercises in children.
Exactly.
Because you said this is one of the things that will trigger this if the child eats and does not exercise well. So how should parents ensure that children exercise, or how do you plan their meals or regulate what they eat so as not to put down on this?
Now, talking about exercise in children in the context of diabetes, I will look at it let's look at it from two angles, before and after the diagnosis of diabetes is made. Generally, children should not spend the bulk of their time in front of TV and binging of, like I said initially. Exercise is just a matter of the child doing the normal house calls, let the child run around. Unfortunately, these days now, because parents now have housemaid, they now have house nannies and grannies. So the child comes back from school, eats, and sits in front of the TV, watches TV from morning till night, and everybody run around on his or her behalf. So the child keeps adding weight, and nobody's doing anything about it too. And in some schools too, they don't get to do exercising. So talking about exercise with children, we're not really talking about rigorous physical exercise like adults. It's just a matter of the child doing the normal house chores, walking around and going out, washing plates and doing those things. So exactly, could also be of great help too. Now, but for children who eventually develop diabetes, there is also a note of warning when it comes to exercise. They can actually develop, the blood sugar can actually fall so much during exercising, especially when they're on drugs, that they can make them unconscious. So for such children, the teachers in school should know, friends should know that, imagine 3 or 4 children doing exercise, doing physical exercise, and one of them just fall and collapse. So they get to know it could be a sign of diabetes. We do see children that suddenly they have a low blood glucose and begin to twitch, and from there, if you don't take note, they will go unconscious. So breastfeeding, children like that should be much more breastfed frequently, especially, or they should also be placed on their intravenous blood glucose if they find out that their blood glucose is low as a result of maternal diabetes too. So you need to feed children, neonates that have symptoms of diabetes much more frequently like others too.
All right, on this note, I want to thank you very much for being part of the show. Thank you, Dr. Abayomi Afe.
Thank you
for your time.
Thank you for having me.
Well, so much for the program today. I'm sure that as parents, as wards, as guardian, you have been informed watching today's edition of Children's Clinic. I have learned so much, particularly what struck me was the fact that even insecticides can be very, very vulnerable for children. So as parents, we have to guard against this and know that when you're managing children with diabetes, you have to keep an eye on them. And then, like the doctor said, always keep a note in your child's school bag. So in case of any eventuality, we're not praying for anything bad, but in case of eventuality, keep a note there and keep a phone number on who can be called in case of eventuality for your child. Thank you for being a part of Children's Clinic today. We took a look at diabetes in children. I'm sure you have been informed. My name is Jumoke Ade, so I'll see you again next week on the show. Do have a wonderful life and stay healthy.